Good afternoon, good morning, everyone. And thank you for joining this breakout session. Today, we are going to talk about the interoperability of data management systems to support COVID response in Malawi, and specifically a case of Chipatala Foni that the Ministry of Health with the support of VillageReach has put together. Today we'll have two speakers. First, Upile Kachila. She is a health specialist with a wealth of experience in engaging governments, influencing national health policies, and building organizational capacities. She's a senior program manager with VillageReach and manages the transition of Chipatala Foni, or also called Health Center by Phone, a solution to the Malawi government, and replication and adaptation of the solution to new countries. She will be joined with Mr. Mwalwanda, who is a software product manager in the digital health division of the Ministry of Health of Malawi. Without further ado, I'm gonna let Ms. Upile present. Thank you.
Thank you very much, Olivier. As has been mentioned, today we're presenting on the interoperability of data management systems to support the COVID-19 response in Malawi, and we'll be zoning in on a case study of the Chipatala Phoni, also known as the Health Center by Phone initiative in Malawi. So to give a bit of a background, the Chipatala Phoni platform is a toll-free mobile health hotline which gives access to communities to call and connect with a hotline agent to get a wealth of information on areas to do with health and nutrition. So the hotline operates 24 hours a day, 7 days a week, and is accessed for free to subscribers who are subscribed to currently the Airtel network, even though there are plans underway to unlock it to other mobile network operators. The hotline has got two functions. One is a platform where clients connect directly with the health worker or an agent and ask questions and get personalized, tailored responses to their queries. Another component is that of the messaging piece, whereby we have voices that are recorded and uploaded onto the platform of the hotline platform, and these messages are then retrieved by the callers so they can dial in the hotline number and choose an option to listen to the pre-recorded messages. And these messages are cutting across all health topics. And now we also include the COVID-19 information. So all they need is just to get access to a phone and dial in and listen to these pre-recorded messages to get answers that meet their health needs. And then with regards to the COVID-19 pandemic, the hotline was marked as the primary resource to provide Ministry of Health approved information as well as advice revolving around COVID-19. So from March of this year, the hotline became the national platform to equip clients with information and advice on how to prevent as well as look out for any possible COVID-19 symptoms. And since that time, when the Malawi government earmarked Chipatala Phoni as the national platform for COVID-19 information, we have received a lot of calls coming in from the communities And these calls have been mainly around, wanting to know what COVID-19 is, how they can prevent themselves, how COVID-19 is transmitted, but also we've been getting a lot of other information that could indicate possible myths and misconceptions and misinformation that are being shared at the community level. So based on what we have been receiving and the information that has been coming in, we have been able to take note of the various demographics that the data answers. So for instance, through the interactions that we have with the callers, we're able to know who has called, their age, their sex, their occupation, and then we're also able to know where within the country they are calling from. And this information gets too detailed to the level of knowing what their nearest health center is. And this is done so that we have an idea of where exactly that caller is coming in from, so that we are able to then come up with some informed decisions on how to support. And also, apart from that, we are able to track the reasons why people call, the main areas of concern. If they're also indicating some possible symptoms, we're also able to track that as well. Aside from that, we're also able to then see the preferences that, the clients portray when they connect with the hotline. If they would want to connect with the hotline agent, or maybe they would want to opt in and listen to those pre-recorded messages in order to get the answers that they're looking for. Aside from this, we're also able to then analyze that interaction and the data to kind of map out what the possible call outcomes were and the advice that was given. And this is done so that we're able to have some very good and robust quality improvement mechanisms, so that at the end of the day, the information that is being pushed out to the clients is information that is adhering to the standards that have been defined by the Ministry of Health, and also maintaining good quality, so that at the end of the day, we know that our clients have been given accurate information. Now to circle back to COVID-19 and how that has affected or impacted the call volume at the hotline. Before the hotline was marked as the national platform for COVID-19 information, we were also able to, have a bit of call demand coming in on a monthly basis. And these were callers looking for information around maternal and child health, reproductive health, nutrition, and any other health topic. And at the time, demand was quite low. We were seeing around 2,500 interactions on a monthly basis. But from March, when the hotline was, marked as the main dissemination hub for COVID-19 information, we did see a tremendous increase in the call volume, to the extent of, having demand jump at least by 428% in just over a period of 2 weeks. So what we were seeing on a monthly basis, that number was, it quadrupled to get to where we are now. And then, of course, as I've mentioned, that the hotline has two platforms. One platform where people call and talk to hotline agents. We have seen that the number of calls that are answered on a given day have risen. We're able to now answer around 150 more calls than we were before. And then when we look at how people are interacting with the recorded messages, again, that has also risen tremendously by around 397%. Just to show you how there has been that increased demand. People are demanding to get a lot of information and advice on COVID-19. And even though this is the case, people are still also calling for other health topics. So the hotline has become popular, not only as a hub for COVID-19, but also a hub to provide Ministry of Health approved information and advice on any aspect to do with their health and well-being. And then what happens when we have seen a significant change in how we have, analyzed the data, but also presented it throughout the course of the past year and this year as well. So as you can see, in 2019, our system was still developing. We were still making some adaptations and enhancements. So we were hugely relying on the mechanical aspect of data analysis and visualization. So we would collect the raw data and analyze it manually, and then pull out those visuals that inform decision making. And we did see that this process was quite cumbersome, and it was taking a lot of time for us to go through all that data that had been compiled over a month, and then begin to clean it up and analyze in a way that is realistic as well as easy to use. So what we did see beyond 2019 was a move to, provide some weekly reports. Again, we were still having to manually analyze that data so that we could ably pull out information on the call volume, as well as the time that the hotline was busiest, in order to inform some critical operational decisions. And now where we are is that now we're still working on some system adaptations and improvements to bring about some automation of the data, so that it should lessen the time that it takes to analyze and visualize that data. And we're looking at going further, deeper, and not just zoning on the core volume as well as the peak periods of the call, but also to understand a little bit more about the health of the particular clients. And we believe that once we have this holistically captured, the information that would be gathered, the evidence that would be gathered, would be used to inform some critical strategic decisions, as well as some operational decisions that have to be made in order to ensure that the hotline is operating at its maximum efficiency. So based on that, there are a couple of things that we're, capturing as at now. And this information is being used to inform various interests that the Ministry of Health are currently using to bring about evidence-based decisions as they're forming their response efforts to combat COVID-19. So when we begin to critically analyze the various unique interactions that we have with our clients, that information is then analyzed further to kind of come up with some more concrete information on what it is that we're hearing from the clients. And through that interaction, this information has been used to develop more streamlined trees for our platform in order to improve the completeness of data. At the same time, when we look at the volume, we are taking that the increased number of calls that we're receiving at the hotline would, contribute immensely towards giving a good indication of the situation on the ground. And in so doing, that provides with very good decisions that should be made when it comes to hotline efficiency. But also at the same time, when we look at the staffing requirements that are there, we are guided by this call volume to know how many people would need on deck at a given, during a given shift. And then also to proceed, when we then refine the reason for calling, we do see that this information is also helping guide the various strategies that the Ministry of Health would want to, deploy on the ground, because the information that we're getting has specific answers, gives specific answers to how effective the communication is on the ground, or how efficient the various communication mediums that are being used are in addressing the various concerns and the various questions of the public. And then moving forward, as I've mentioned, that there are a couple of myths and misconceptions that the hotline is currently gathering. But on top of that, we also have some frequently asked questions that we're pulling from the communities. And these are put together to help inform the various strategies that the Ministry of Health would want to deploy, as well as inform the content that we're using at the hotline. So as I've mentioned, that we have those recorded messages. So based on the misconceptions that we get, we begin to reassess those recorded messages and bring about new content that will address the misconceptions or the questions that we're getting. At the same time, we are also using the very same information to update the modules that the hotline staff are using as they interact with their clients. So further to the data that we're gathering, we as at now are able to use the very same data to come up with some possible heat maps that would demonstrate where the calls are coming from. And we have seen that this, especially now in the COVID-19 era, when we do get a lot of calls from a particular region that are talking about possible COVID-19 symptoms, that can then be used by the Ministry of Health to come up with some concrete response strategies to go to that region and help combat if there is any possible outbreak in that region, come up with some preventive measures that would control the further outbreak or the escalation of the same in that particular region or area. And then, of course, we feel that there's still a lot more that we can do with the data that we're getting beyond just, providing that surveillance aspect of. We're also looking at ways to kind of come up with some approach that would bring about potential disease modeling so that at the end of the day, the Ministry of Health would use that data to predict any possible patterns that are coming in from the interactions with the clients. And through these patterns from the caller data that we're getting, they can also use that to kind of inform whatever strategies that might be required as means to come up with some very good and well-defined response efforts. So at this point, I'll pause and hand over to my colleague. Over to you.
Thank you very much, Billy. Hello, everyone again. So I will maybe start off with explaining where we are at with, as a ministry, where we're coming from, and also looking at what are the next plans in terms of the work we have with the national systems. As a primer, DHIS2 was adopted by the Ministry of Health as the national health, data warehouse. And there are a few reasons for that decision being made. And then one of it was obviously the robustness of the platform, the community behind DHIS2, and also most importantly was the availability of integrating analytics within the platform. So the ministry wanted a way to have like everything that has everything included in there. And one of the main things that they were looking into was being able to make decisions out of the data that's being collected countrywide, coming up with visualizations all in the same platform. And then also with the advent of COVID-19, the ministry activated a DHIS2 tracker program instance. That was work that was already ongoing, but COVID-19 facilitated that whole work. Now this was aimed at looking into the surveillance of clients. In this case, we're talking about people. The ideal implementation was to target all aspects of life. So I'm speaking of people, animals, and also the environment. But now we targeted humans for now as a starting purpose, with the advent of COVID-19, and that's where we are now. And then obviously we knew that there are other systems in isolation or other systems in the wild. So there was, one of the critical things to do in the first place as well was to provide, a way of integrating with any app that's there, and then to have all that information in one place. And that's where we have, systems like CCPF, Chipatala Foni, we've worked very well with the Open MIS or Chemonics team, and those are responsible for drug logistics within the country. And that's also data that's required, and we are working close with them as well to have everything in check. And then maybe speaking of the CCP use cases, we are doing right now, the very first use case would be to periodically ingest aggregate data from the platform into the HMIS, which is the HS2. And then also we will look into the patient level data, which will also need to land itself into OHSP. Now, OHSP means One Health Surveillance Platform. That's the DHS2 tracker instance I was talking about. Next slide, please. Thank you. Now, for the OHSP CCPF integration, this is the proposed architecture, or how it looks like as a start. And then what we have is OHSP, CCPF on the other side, on the far left. And then, via its API, we plan on periodically, depending on how we program the CCPF dataset in DHS2, we should be able to be, periodically pour the platform, get whatever data it has within itself, and then feed that into DHS2 where there'll be the visualizations. The CCPF team has done great work in terms of the visualizations. So speaking of, I think they use Google Studio for that. And then we also want to replicate that same workflow into the system, which is the DHS2 instance. So speaking of system integration with CCPF, that's in a nutshell how it looks like, and that's the end of my presentation. Thank you everyone for listening. Hope you have a good day.
What a wonderful example of a way to use an existing tool and adapt it to be able to help with the response with COVID. And also what a wonderful example of a transition to full ownership of this tool to the government of Malawi, and the government of Malawi really embracing it to help manage this pandemic in Malawi. And also I love to see how this tool has been well integrated into the national HMIS of the country, which will really is an enabler for the sustainability of such a data management tool. I want to thank Upile as well as Mr. Mwalwanda for this wonderful presentation. And also I want to thank you all for attending this breakout session. And I wish you a good rest of your day, everyone. Thank you.